Go over very well. No. So do we have anybody on WebEx today? Okay. The vice had something he had to take care of, so he was going to try to get in on WebEx later, and I'm not sure about Representative Reese. Do you know if she's going to be on? Okay. All right. So we've got a fairly full agenda today, and so I'll start with, is there a request for any bill introductions from anyone? Oh, okay, so that takes care of that. So before we get into some of the presentations, we'd ask for an overview of the budget process, and Dayton is going to take care of that, and we'll get rolling. And this is, for those in the audience as well as really for some of the newer members of the committee. So Dayton, take it away, please.
Thank you, Mr. Chair, members of the committee, Dayton Lemunion Legislative Research. So you should have a memo in front of you titled Budget Basics. This walks through the basics of the state budget and kind of what you'll be considering as you consider the budget summary documents. So the first category there is, of course, the funding that's used to fund expenditures by the state. The first category there is State General Fund. It's the main source of revenue from taxes, including individual and corporate income taxes, sales and compensating uses, and interest earnings. This is used to fund, a number of projects across all state agencies, compared to the next category, which is state special revenue funds. So there are several hundred of those. Some of those are agency fee funds. You'll hear a number of fee fund presentations today. Those agencies typically receive, application fees, licensure fees, and retain those to fund their agency operations, as well as other special revenue funds, appropriated special revenue funds like the Economic Development Initiatives Fund, the Expanded Lottery Act Revenue Fund, that are used to fund expenditures in a number of agencies. And then the final category are federal funds that the state receives from the federal government. So those are the sources of funding the expenditures. The next category, or the next section of the memo, talks about expenditures, which are divided into a number of categories. The first category is salaries and wages. These are payments to employees of the state and include both the salary as well as the benefits associated. And if you'll turn to page 2. The next category is contractual services. These expenditures include a variety of services that are not performed by agency staff, but are contracted, and hence the name contractual services. The next category is commodities, which are consumables used by state agencies, followed by capital outlay, which are expenditures for those longer-term replacement of longer-term equipment of more than 1 year. The next category, aid to local governments, which are payments made from state or federal funds to county, city, school districts, and other taxing authorities. The next category, other assistance, grants, and benefits. These payments are made to individuals as aid, include public assistance, so a lot of Medicaid dollars will be categorized as other assistance. And then the final category are capital improvements, which are payments for construction of buildings or other state property. So all of those combined make up the expenditures of the state budget. And all state expenditures will be categorized in one of those categories. So you'll hear a discussion about those categories as you hear the presentations. And then moving to that final section, this walks you through sort of the different starting points that you'll hear referenced in the budget summaries. So each year, the legislature puts together an approved budget for at least the current year and the following year. Some agencies are biennial agencies, so they receive they receive an out-year budget. So 3 years are budgeted in the first year of a biennium. All others receive just the current and budget year. The agency request is the request by the agency to either modify their approved budget for the current year or their request for their budget year, their following year budget. And turning to page 3. During the interim The Special Committee on Legislative Budget met to review the agency requested budgets for the current and budget and out year, and they made recommendations as to the level of funding for each agency. So as you hear presentations from our analysts, we'll reference the agency request against the legislative budget recommendation. And then the final category there is performance-based budgeting. The agencies do submit performance measures, and we compile those into a publication, which we have available if any of you are interested. So I now stand up for questions on that part.
Okay, committee, any questions of Dayton? Moving right along, Dayton?
All right, so I'm sure you'll have a lot more questions actually when you actually hear a budget and can connect them. The next kind of sort of step is the actual process of the budget. So you all are the budget committee. You'll meet and hear the request by the agency, the legislative budget recommendation. You'll make a recommendation on each budget as to the level of expenditures, which will move to House Appropriations, which will review your recommendation and put together a bill, which will be passed by the House. Once the Senate has a position, the House and Senate will come together, conference on the bill, and create the budget. I mean, you all know that process, but just a little more detail.
It's as easy as that? Not. I would say, yeah. So, seriously, any questions of Dayton? So, we're about to begin the budgeting process here next week. So I just want to make sure everybody knows what the playing field is. So, anything else to offer, Dayton?
No, I'll turn it over to Megan. She's going to actually walk through the budget summary document, which is the format that you'll hear all of the budgets in.
Okay, thank you, Dayton.
Thank you.
Megan?
Good afternoon. If it's all right with you, I think what I might do is take a two birds, one stone opportunity, and I'm going to present the Board of Pharmacy's budget. And so I will present that budget, but do it very slowly and go through the parts of the budget and describe them as we go.
I like that approach. Thank you.
Okay. So on the first page, you should be looking at the packet that says the Kansas Board of Pharmacy at the top. That's the easy part. And Alexander Blasey, who's the Executive Secretary of the Board of Pharmacy, is here in the audience. She'll have some words after I present the budget summary, and she's also available for any questions you might have. So the front table on the front page is the overview table. At the top, you can see that the expenditures of the agency are broken out into the categories that Dayton just described. And then the columns make up the actuals for fiscal year 24, which is what the agency actually spent. Then the agency's budget request for fiscal year 25. The next column is the LBC committee's recommendation. This is the committee that met over the interim, and they made recommendations based on the agency's requests. So any differences that came out, any budgetary differences that came out of that committee will be listed in that column there. Then in fiscal year 26, you can see the agency's request. And then again, it's followed by the Legislative Budget Committee's recommendations. At the bottom, you can see the financing. Well, about 2/3 of the way through the table. This shows you how the agency is financed. For example, State General Fund for the Board of Pharmacy and many of the fee boards that you hear in this committee, there will not be any State General Fund that is going into those agencies. So you can see here that the Board of Pharmacy is largely funded through their Board of Pharmacy fee fund. This is their fee fund that gains revenue through those that they license. And then you can also see that they have some federal funds there at the bottom. And then at the very bottom of that table, you can see the percent change. And this shows you the percent change from the actuals to the agency's request, and then from the agency request to any changes that the LBC made. Are there any questions about that table?
Committee, any questions? Perfect.
Okay. And then under that is the agency description. So you can see that the Board of Pharmacy, they ensure that people and entities conducting business relating to the practice of pharmacy in Kansas are doing so properly and safely, and that they are registered to protect the public health, safety, and welfare of Kansans. They enforce the Pharmacy Act and the Controlled Substances Act. They register and license 8,400 pharmacists, 7,500 technicians, and 6,500 pharmacies or facilities. On page 2 is the fiscal year 25 analysis. At the top is a bar chart, and it's just a visual representation of the agency's 2024 actuals, what they were approved to spend in fiscal year 25, what the agency is requesting to spend in fiscal year 25 with their new revised estimate, and then what the LBC is recommended. So these are the same numbers from the front page, it's just a different representation. Underneath that is the budget comparison. So on the right, the gray column, you can see that the agency's change from the previous year's actuals is $548,085. And that's a 16.3% increase from what they actually spent in fiscal year 24. You can also see that the agency has a decrease of $242,000 or 5.8%, and that's below what they were approved to spend. The budget analysis table, that is the last table on the page, figure 4. At the very top line, you can see the approved amount. So this shows you the amount that the agency was approved to spend in fiscal year 25 by last year's legislature. This is what was included in the budget bills. Then you can also see a line for SGF reappropriations. If the agency has any reappropriations, they'll show up here. This agency does not, they do not receive any SGF. Under supplemental requests, you'll see any supplemental requests that the agency has made. These are largely large changes to the budget or things that were not discussed in the previous year's budget that are new. And then other changes, these are changes that generally will be expected to occur throughout the course of a year in an agency's budget, shifts in the way that they're spending their money, as well as, certain things cost more than expected, other things less, and you'll see those changes show up here. And then underneath that table are numbers that correspond with each of the rows in the table, and they provide an explanation. So you can see that for number 1, the agency did not have any SGF funds reappropriated. For number 2, they did not have any supplemental enhancement or supplemental requests for fiscal year 25. And for number 3, they did have a deletion of $182,000 for contractual services. And in the text there, you can see that this was largely due to a software application that they were using for the K-Trax program, that after doing a cost-benefit analysis, they decided the costs weren't justified by the utilization. And then for number 4, you can see that there is a $60,000 decrease and this was a passenger car that they had budgeted for in fiscal year 25 that they ended up not purchasing. They purchased it the year before. And so there is a decrease in their estimate for that. I'm happy to stand for any questions for fiscal year 25.
So this would be considered one of the easier budgets, I would think, in comparison. But I would open up to any questions on the process or the numbers, Representative King.
Yes, Megan, just going back to chart, let's see, figure number 4. And I'm just going to ask some questions, not necessarily for this, but just in general. FTEs of 20, so that means they have a total for their agency of 20? Or is that an increase or decrease? Or where would we see if they would have an increase or a decrease of FTEs?
That would show up on that table right there. So if they were asking to increase from, well, if there is a change between what the agency was approved, like let's say they had been approved 19 FTEs rather than 20, then below that in the other changes or the supplemental request, you would see an addition, and then at the bottom it would say 20.
So if we see no change in something like this, that just means it's the same amount for each year then?
That's right. You can also see on the very front page on that overview table, at the bottom is a line with FTE positions, and that's where you can see if they had any changes year over year.
Committee, any other questions? Awesome. You want to move into the next one?
All right, we'll move on to page 4. And this is the fiscal year 26 analysis. So at the top, you see the same bar graph, the approved amount, the agency's request for fiscal year 26, and then the LBC's recommendation. And in figure 6, you can see that the agency has requested an increase of 119,000, or that's 3%, and that's above what they requested the previous year. So between their 25 request and their 26 request, there's an increase of 119,000. But you can also see that between what they were approved to spend in fiscal year 25 and what they're requesting for fiscal year 26, there is a decrease of 123,000, or 3%. And then in figure 7, it's the same table as fiscal year 26, or I'm sorry, fiscal year 25. At the top is the fiscal year 25 approved amount. Below that is a row for enhancement requests. And then below that, any other changes. One thing that is different in the budget summaries that we've prepared this year as compared to previous years is that with fiscal years 26 and 27, we're comparing back to the fiscal year 25 approved. So in that column there, you'll essentially see the combination of what they have requested in 25 and what they've requested in 26, because it's going back to that approved amount.
Representative Ballard?
Thank you, Mr. Chair. I think we should, when you say what's different, when I'm listening to you, number one, we never have had to deal with the Legislative Budget Committee. So we've never had to compare that to what it was before. So if it was appropriated in 2025, then that's what we would have dealt with and we moved on. But now we're looking at two different kinds of budgets in terms of one would be the LBC, the budget, and whatever was the governor had recommended in hers. So when we look at those figures, we're going to be looking at two different ones. Does that make sense? And I thought I would explain that because I'm sitting here thinking, whoa, that's not how I've done it for 20-some years. But they'll show the difference. And when we are building the budget, then we would have to look at it in terms of what was appropriated, was anything deducted, and then how do we look at that? But when you look at these budgets here, we're not talking about SGF that's in them. They either have to raise their own money or they had their own grants or whatever they had in the process. And this is an easy one to do. I'm going to be with you when we get on the other one because I wouldn't have done it that way either to try to figure out how we are construing the budget.
Mr. Chair.
Representative King?
So Representative Ballard, if as there would be an increase here, there would be an increase in fees, so there would be an increase to the amount that the consumer would be paying because potentially there'd be an increase in fees then.
And how would you answer that? I'm not sure about that.
I mean, the money has to come from somewhere, the increase.
That's correct, although there isn't a direct correlation between what the agency is spending in each budget and the fees. Where that comes in, or where that's easier to see, is on the last page. There's a fee fund table, and that explains the revenue that they get from their fees. And the fees are changed on I would say, a bigger picture, so that if the agency is struggling to maintain an ending balance or fund, they might then consider to raise fees or lower fees for the opposite reason.
That answer your question? Okay. We can continue.
I will back up one second because I think Representative Ballard had a really good point that one major difference in this that I didn't mention before is that we do have this column for the Legislative Budget Committee, and previously that would have been the governor's recommendation, so we would have been comparing those items. And so when you're looking at this, we are looking at those recommendations made by the Budget Committee. All right, I will move. Well, actually, I don't think I finished fiscal year 26. I just wanted to add that for the other changes, row number 2, or number 2 on the bottom figure 7, you can see that they deleted 123,000. And this, again, was a result of the NARX Care software that they didn't renew, as well as increasing their salaries and wages as they anticipate filling positions that have been open. All right, and then on page 5, you can see the fiscal year 27 analysis. This is a fee-funded agency. There are a handful of agencies in the legislature that are required to budget 2 years out. And so for those agencies, you'll see fiscal year 25, 26, and 27. This won't be the case for all agencies. For in this committee, many of them will only have fiscal years 25 and 26. So for 27, you can see that the agency has requested an increase of $52,000 or 1.3% above the previous year, so above fiscal year 26. And they have a decrease of $70,000 or 1.7% from what was they were approved to spend in fiscal year 25. So in the figure 10, you can see their approved amount, the 20 FTEs. And then below that, in the all other changes, you can see that they have a decrease of $70,848. That is, again, that software that came into play and caused a decrease in prior years, but it's being offset by increased expenditures for salaries and wages as they fill positions, as well as budgeting for a passenger car. And then another item that I didn't point out earlier is that under each of the adjustments, you'll see a bullet point that says agency. So that points out what it is that the agency is wanting to do in their budget. So they're either adding or deleting for the most part. And then underneath that, you'll see an LBC bullet. And if there are any changes that were made in the LBC's recommendation to the agency's budget, it'll have it in that line. In this budget, there were not any changes. All right, on page 6, there's a reference table that shows a 10-year look back on the agency's expenditures and their FTEs. And then on the very last page of the budget is an overview of the agency's fee fund. So on page 7, you'll see the special revenue fund overview. This shows their year-over-year revenues and expenditures for their main fee fund. This is what funds the primary funding source for their agency. And you can see the ending balance there as well. And then finally, on the very last page, are a list of the fees that the agency charges for their licensures. And with that, I'm happy to stand for questions.
So committee, any questions? So I do want to reiterate, I think, the point that Representative Ballard made. It's a new way to look at the budget. Intentionally, we're taking it one of the easier ones, so to speak. So this will be the same mechanism to look at the other couple ones today, but it's basically the same process, and we chose ones that were, I guess, easier to digest. There's a better way to say that. I'm not sure if there is.
Representative Opeza had a question.
Say again, please.
So Representative Opeza had.
Oh, yes, Representative Orpeza.
I mean, I don't know if this is appropriate question for you, but there's a purchase of a car. Can that be elaborated on?
Sure. I can tell you what I have, and then that's a great question for the
Okay.
agency.
Thank you.
They're looking to replace one of their current cars, which is a 2014 Impala. And they're looking to do that in 2027. That is the extent of my information, but I'm sure that they would have more to say.
Okay, thank you.
We may have a question on WebEx, or just two on, okay?
Representative Reese on? Susan Reese, yeah.
Representative Reese, are you on?
Yes, thank you. Thank you for recognizing me. Um, I could not hear most of anything that Representative Ballard was asking. So I just looking for a clarification again. So when we look at the budget and we look what's approved is through that extra committee that was put together for budgeting. Is that them saying that's what they're approving?
No, the approved line is what was approved by the legislature in last year's budget bill. And it's only for fiscal year '25, because that's obviously the only year that the legislature has an approved budget for. And for each of the fiscal years going out beyond fiscal year '25, we're comparing it back to what the legislature approved.
Okay, okay. Then I guess I'm still confused about this extra budget committee that was put together as to what their role is.
May I? Let me,
It's the Legislative Budget Council that it was authorized by the Legislative Coordinating Committee, and that is the starting point for budgeting this year.
yeah.
Representative Ballard.
Since you, I'm sorry, Representative Reese, I apologize, you couldn't hear me. I was trying to point that out. During the interim, they asked to look at the Legislative Budget Committee. And part of it is during the summer, they went through and they looked at all kind of things for that budget so that the legislature would be submitting its own budget as well as the governor would be submitting her budget. And that's what she's covering right now. But it was based on what we worked off of last year as for the figures. And eventually between the Legislative Budget Committee and the one that the governors, they will do a comparison between the two to see what the difference might be. And then I think for our committee, we're going to have to look at how we're going to balance that. Does that help at all, Representative Reese?
No, I think it's more confusing, and I think it's more confusing for our constituents to try to figure this out as to why there's another entity looking at the budget. But I'm not I'm not going to complain more about that. I'm still trying to, just and once I'm there next week and I'm there and I'm juggling, screens, then it'll be easier for me to really see, the budget items that we're actually looking and as to, what was approved, what's not, what's coming from the governor and what's coming from that other committee. So I apologize. I'm sure it'll be easier on me when I get back. Thank you.
Thank you, Representative Reese. And this is the process, so there will be reconciliation with what the governor has submitted, but this is the process that we're working through for now. So we need to take these budgets and this analysis and feed it into the appropriations process, because these recommendations start feeding into appropriations next week. So I would just ask for patience, and we will train and learn this together. So, okay, Megan, is there anything else?
May I have one more comment? The governor's recommendation, we will be providing committees with a printout of the governor's recommendation, so you will be able to see more clearly how her recommendation differed from the agency's. We will only have a printout that shows the differences, and in this case, for the Board of Pharmacy's budget, there were no differences between the agency's request or the LBC recommendation or the governor's recommendation, and so I don't have anything to present.
And I would say, again, just for the sake of this committee, there's no subterfuge here. These were intentionally chosen for precisely the reasons that Megan suggested today, so we can understand this process on things that are fairly benign. So that's the intent. So thank you. Okay, so next up, if we're done with that one, is we have mortuary arts. Are we? Alex? Welcome to committee from the Board of Board of Pharmacy.
Yes, thank you, Mr. Chair. I'm Alexandra Blasi. I'm the Executive Director for the Kansas State Board of Pharmacy, and appreciate the opportunity to provide you with some remarks regarding the Board of Pharmacy. I'm probably a new face to some of you, and so I thought maybe it might be helpful to just give a quick bird's eye view of our agency. Megan did a very nice job explaining the mission of what we do, but I've been with the Board of Pharmacy for 9 years in this role, and most people don't realize that we actually touch a number of aspects of pharmacy, not just what you may see in your regular routine retail pharmacy when you go to pick up your prescription, but the Board of Pharmacy actually licenses all of the pharmacists and other pharmacy personnel that are working in those facilities, as well as all of the different facilities that dispense drugs and/or distribute or manufacture drugs that are doing business in the state of Kansas. So we actually have licensees and registrants in all 50 states that are maybe shipping medications into the state of Kansas, whether that's through the mail or business to business, manufacturer sending through a distributor or a third-party logistics provider, even like FedEx, and then ultimately those medications are ending at your local hospital or pharmacy for distribution and dispensing to the patient or administration to the patient. So those are the folks that we license and register. In addition to that, we are actually responsible for going out and doing in-person inspections. So those vehicles are specifically for our staff pharmacists and other compliance inspectors that go out and do the routine compliance inspections of all of those different facilities registered with our agency. We try to go to the pharmacies about once a year. Sometimes that gets stretched to about 2 years, and we try to prioritize who maybe has had compliance issues in the past or needs more attention or education versus those that have been on the straight and narrow for a while and have a demonstrated track record of compliance. In addition, all those other types of facilities, manufacturers or distributors that may be located here, those facilities we end up going to usually about once every 3 years pursuant to the statute. We also register places called durable medical equipment providers. And so when you think about all of those other pieces that you may be prescribed or tubing or even like CPAP machines or things like that you might utilize in the healthcare segment, those are also dispensed under the Board of Pharmacy's regulation. We are also responsible for something called the Drug Monitoring Program, Prescription Monitoring Program in Kansas, which most people affectionately know as K-Tracks. And that entire system is under the Board of Pharmacy's regulation because pharmacies are actually the entities that are reporting their data to the systems. And that system collects data on all controlled substance 2, 3, and 4 schedules that are dispensed in an outpatient setting to patients. And you can think of things like stimulants such as ADHD medications, opioids, benzodiazepines, and those kinds of more potentially hazardous and prone to misuse or abuse medications. And so when those prescriptions are dispensed to the patient, they're then reported to our K-Track system. That is not for government use. It is actually for prescriber and pharmacist use. So that is a tool for them in their clinical decision making. They register with our agency for credentials, and then they are able to access that system to review their patient's history before making a prescribing or a dispensing decision. So that kind of gives you a little bit of a high-level overview of what we do. We are very proud of our performance measures, and I've highlighted some of those in your packet for today. I also would like to note that, much as Megan said, we are in a position this year where we are actually asking for a lower expenditure than we have in the past. One of the things that I'd like to highlight for you on page 2 of my testimony is actually that we have a pretty strong track record of this. And people may wonder, why are we asking for more money and then reducing that down the next year or in the current year? And the answer to that is actually related to federal grant money. So a very significant portion of our expenses at the Board of Pharmacy is related to the K-Tracks software, which is we contract with a vendor to host that. That vendor actually provides that same platform to about 40 states. So they're a very popular platform and have an excellent track record. We've been with them since 2010, I believe. And that is expensive software. However, we are able to leverage some of our projects and things like that to apply for federal grants. We have been doing that since the inception of the program in 2008 very successfully. In fact, I'm pleased to report that to date, we have never been denied a grant application that we have applied for. So that is exciting. And what it ultimately means is that we are able then to offset some of our planned expenditures with the federal grants that we have for the ongoing projects and software and things like that. So that is really what you see reflected there, that what we ask for when we have to project out 2 years. At this point, I don't even know what grant applications will be available in 2 years, and so we cannot apply for them until they become available. And then there is obviously an application process, an award process, and then it's usually about 1.5 years before we actually start receiving dollars under that grant. So we are currently the recipients of 2 federal grants directly, and then we have subrecipient agreements with 2 other state agencies, the Department of Health and Environment and the Department on Aging and Disability Services. And so KDADS and KDHE are project partners for us in this KTRACS venture. And as a result of those things, we have been able to, as we are in that fiscal year, make an adjustment to spend less of our expenditure authority, utilizing those grant funds as supplement. And then that's what you see. So it's our original approved budget and I just went back to fiscal year 2020, our revised budget that we then present to you later, and then our actual expenditures are usually quite lower. Now, I only did reflect that in the pharmacy fee fund because that is ultimately, I think, the focus of the dollars that we spend. But we do have a significant amount of federal grant funding coming in. So we're very pleased with that. And we've been able to do a lot with that, as you can see, based on the increase in the queries to that system and the number of active electronic health records integrations that we have. I would also like to just highlight a couple of other things. One is that I would like to say a thank you to both this committee as well as the Kansas Legislature for the cost of living adjustments and market rate adjustments you all have been working toward over the last few years. I can tell you that that has made a significant difference in terms of agency staff retention and recruitment. And I know my staff joins me in saying thank you for the opportunity for those adjustments and increases. And I hope that this committee and the legislature will continue to look at that as years go by and we receive other market data and those market adjustments from the community. And last, I'll just finish with, we are in a pretty stable position in terms of our cash balance. I know you're seeing that trail off because of the unpredictability of fiscal year 26 and 27. Obviously, we anticipate applying for future grants, and so we would expect that it would not dip below an appropriate level. At this time, we have no anticipation of any fee increases, and the last time we did increase our fees was in May of 2019. I'll also, just so you are aware, we do not have the authority to go beyond statutory caps that the legislature sets for each of our individual fees. In addition to that, even if we want to change a fee within the statutory cap, increase or decrease, the board does have to do that through administrative rulemaking. And so there is a formal process, and there, of course, there's the Joint Committee on Administrative Rules and Regulations that would review that as well. But we don't anticipate that at this time. But I just wanted to clarify that that would be the process if we needed or wanted to do that in the future. So we can't just decide randomly that we'd like to increase a fee and then implement that. With that, Mr. Chairman, I'd be happy to stand for any questions. I hope I didn't take up too much of your time.
Committee, any questions? Representative Ballard?
I would just, thank you very much, Mr. Chair. I would just like to comment on, there's a long history with our pharmacy and especially with KTRACS. And part of that was, if initially the state had helped a little bit on trying to do it. We were trying to decide so people wouldn't go around and get 5 or 6 different pharmacy prescriptions some other place. Part of KTRACS is to eliminate that from happening as well. And at one point, the state said you're going to have to start supporting yourself, and that is what the pharmacy did. Literally wrote grants, bringing in their own money, doing everything else along the line. And so right now, when we look at this, even the appropriations would say, my goodness, they have done an amazing job in making sure that we are not only in this state, but all over, that you're able to track what's going on with prescriptions and also making sure that you're checking on pharmacies and how they're handling all of these things. So in a short period of time, it'd be difficult for you to really understand that. But pharmacy has come a really long way, and the state of Kansas is a lot safer in terms of their prescriptions and how we handle the situation and how we contract it. And I think there was a question about your car, so you probably need to answer that because you fall in a different category than other people in terms of that. So would you do that, please?
Yes, absolutely. So as I mentioned, our inspectors each are assigned a vehicle because they work from their own office. And so that they're able to get to all of their facilities, they have an agency vehicle that is financially more economical than them trying to go out and rent a car every single day that they go out and do inspections. We have a replacement schedule so that we're not buying multiple cars in 1 year to replace old vehicles, but we watch the age of the vehicle, recent repairs to the vehicle, as well as the mileage of the vehicle to make decisions about how to assign the vehicles out so that they're in the best location based on their mileage and longevity, as well as when to replace the vehicles.
Thank you. Committee, any other questions? Representative Steens, pardon me.
Thank you, Mr. Chair, and thank you, Secretary Blasey, for your presentation. I just had a quick question about durable medical equipment, because I have had some questions just from wheelchair companies that say they don't do any of the other medical equipment, like the oxygen and some of those other, or maybe walkers and things like that. And so they are just focused more on the customized wheelchairs or the power wheelchairs, for instance. And so they're kind of like questioning why that would fall under the Kansas Board of Pharmacy.
I don't know the original decision why durable medical equipment was determined to be regulated. It's been many, many years. Generally, it falls under two different categories, either the distribution and shipment of those durable medical equipment items or the dispensation of those items to the ultimate patient. So there are two categories that that company may need to be registered. The companies that are distributing business to business, they're actually eligible for not a full distributor permit, but a non-drug distribution permit. So it is less expensive. I don't remember off the top of my head exactly what it is, but I want to say it's about $50 compared to about $350. So it's a pretty substantial difference. On the patient side, a durable medical equipment facility is registered separately than like a traditional pharmacy. So they have their own registration. What I can tell you is that I believe the FDA sort of makes the determination about what those devices and types of equipment are. So the definition that is found in the Kansas statutes is reflective of the federal definition. And I do know that there are a number of those types of devices and types of equipment that do have expiration dates or other things that need to be checked and ensured that they are safe and effective so that there are not people trying to sell faulty equipment or potentially hazardous equipment. So I think that's why.
Thank you. One more question. Representative Rivas.
Thank you for the presentation. I was at a little testimony for you as a provider using K-Trax over the years. It's been phenomenal. That's a very good
Excellent to hear.
I appreciate that.
Thank you.
I have a question on your FTEs, the reference table on page 6 of your budget. I was looking, you had 12 FTEs in 17 and you're up to 20. So why the increase about 21, 22? It seemed like it started going up.
Yes, absolutely. We have seen a pretty significant increase in the number of registered facilities and the number of complaints that our office has received. So we have added a number of compliance inspectors to our staff over the years, of course, with legislative approval. Also, 4 of our staff were actually added right about that time or after that time, I believe closer to about starting in 2015, 2016. That's when we increased it a little bit more. Those 4 positions are all K-Trax positions, and most of them are grant funded. So that would be the reason for those.
Thank you. Committee, any other questions? Okay, Secretary Blasey, thank you for your presentation, and we'll move on to the next one. Okay, so next up we have the Board of Mortuary Arts. And I think Amanda's taken this one. So in the interest of time, and either I have good or poor facilitation skills, if we're going to make it till 5 o'clock, I'm not pressing us to get out of here on time, but managing, and again, the last budget was, and by design, we were learning the process, we were learning what the new budget looks like, and that's okay. So, but again, we chose some fairly benign budgets, and the next one is the Board of Mortuary Arts, and I'll turn it over to Amanda.
So that means hurry up. Got it. Okay. So I'm Amanda from Legislative Research. The next one you should have in front of you is State Board of Mortuary Arts. Behind me, we do have the Executive Secretary, J.W. Carey, who will be happy to answer any specific questions you have afterwards. So similar to the Board of Nursing, this is a regulatory board. Their responsibility is to oversee the embalmers, funeral directors, and crematories in the state. The board is composed of 5 members, and to support the board, there are 3 staff members, including Secretary Carey behind me, an investigator, and an administration position. Board of Mortuary Arts is a biennial agency, so again, they already have an approved budget for the current year for fiscal year 25 that was passed in last year's appropriations bill, and this body is now considering the 2 budget years in the future, 26 and 27. They're completely funded with licensing fees. There is no state general fund. If you flip to page 2 of the budget summary, you can see that the agency's 25 revised request submitted this past September is the same total amount that they were approved for last session. On that bottom table, kind of in the middle of the page, I guess, you can see the top gray line will show what the board was approved for in last year's budget bill. It's at $346,000. And then in this September, when they submitted their revised budget request, they're asking for that same amount, which is in the yellow bar across the bottom. This means there's no change in the amount approved from the legislature to their revised request. Within that, though, you can see on lines 3 and 4, they're cross-training a new admin position. So they're budgeting a little bit more for salaries and wages and less in other areas. So just shifting some money around there. Flipping forward, you can go to page 4. That's going to have the 26 analysis. If you look at the middle table there, you're going to see that there's about a 2% increase from the amount approved in fiscal year 25. This is primarily because they're projecting an increase in rent as they renew a new 5-year lease at the Jayhawk Tower, as well as an increase in technology fees paid to OITS, Office for Information Technology Services. Lastly, if you flip ahead again to page 6, you're going to see the 27 analysis. Again, with the new process that's being led by the legislature, we're comparing back to the amount approved for the current year in 25. So when you look at that middle table, for fiscal year 27, you can see that there's about a $12,000 increase compared to what they were approved for in 25, so over the course of 2 years. But that being said, there's not a substantive change to what I'm describing to you. They're still going to have to pay more in rent as they renew that lease. They're still going to have to pay those increased fees that happen in 26. And so those increased expenditures just move forward into 27. Page 8 is a reference table giving the 10-year history for the agency, and page 9 has the special revenue fund overview for the Mortuary Arts Fee Fund, including all the fees that they collect. You can see here in the agency request, should that come to pass, the proposed ending balance at the end of 27 is about $123,000. That's in that gold bar showing the ending balance. And with that, I'm happy to stand for any questions on this specific budget.
Okay, committee, so you can see it's the same process that we're going through. Roughly no change in the financial position. So with that, are there any questions for Amanda? Okay, so since we do have Executive Secretary Carey here, let's ask him to come to the well and see if there's any questions. The vice, yeah. We were trying to get him online. It might have been a challenge.
I can see why we were picked for this. So, but with that and in the essence of time, I will stand for questions.
Committee, any questions? I would say you could have embellished a little bit and said it was due to stellar managerial performance and flawless leadership, and I can help you out there if you would like.
I appreciate that.
So, Mr. Secretary, thank you so much. Again, committee, any questions? Representative Ballard.
I'll vouch for him.
Thank you, Representative Ballard. All right, with that, thank you so much.
Thank you.
Okay, so committee, as we're moving on, the next one is the Office of Child Advocate.
This makes me a little nervous because he's talked a lot about how he picked easy agencies to start with today. This does not follow that process. So hold on with me, okay?
I need to find a different adjective. Figure that out.
It's simple, but it's not a straightforward one, but that's okay. We'll be fine. All right. So for the record, again, I'm Amanda Prosser with Legislative Research, here to present the budget summary for Office of the Child Advocate. So this agency was originally established by executive order in 2021 as a division within the Department of Administration's Office of the Public Advocate. Then through the act of the legislature, last biennium, Kansas now has the Office of the Child Advocate as an independent state agency. Behind me, we have Carrie Lawnard, office as acting child advocate. This role is ultimately an individual appointed by the governor and confirmed by the Senate to serve a 5-year term. Other staff employed by the agency include herself, 3 investigators, and an admin position. The mission of this agency, for those new to the committee, is to safeguard the rights of Kansas children, particularly as they interact with the Department for Children and Families, Department of Aging and Disability Services, who both of those you heard from yesterday, along with the juvenile courts, Department of Corrections, and then Department for Health and Environment. And to accomplish this, like I said, they are fully staffed. And their annual report just came out. It is on their website if you have a desire to see some additional detail. But we're going to focus on the budget. So this agency is funded entirely with state general fund dollars. And the front table on page 1 shows actuals for 2024, the request for 25, and the request for 26. The actuals for 24, however, come from the records within Department of Administration, because this is the first year, this is the first time that they're actually submitting a budget through this process, because they were previously located with D of A. Cover that, okay. Flipping to page 2, you're gonna see that they're requesting just under $681,000 state general fund for fiscal year 25. Of that total, about $130,000 is carry forward money from when the agency existed within Department of Administration. The agency has noted that when Senate Bill 115 was passed last session to create them, it also expanded the scope of their work to include youth who have received services from Department of Corrections within the last 5 years. That wasn't an expected thing, that was something new that was added. So that carry forward money in the agency request would be used to fund 1 additional investigator for 25. And other thing I wanted to mention is within that $680,000, about $148,000 are contractual services. They do have a pretty extensive case management system, and then about $3,000 in office commodities. Flipping forward again, all the way to page 4, all the way. We'll see the request for fiscal year 26. Here, the agency submitted 1 enhancement request for 2 case investigative analysts. One of those positions overlaps with the one that I described in 25. So they added 1 in 25, they're adding 2 in 26, but 1 overlaps. So the FTE increase is 2, but 1 from 25, it's kind of a weird, the FTE thing is weird on that one. New agency, part of how it goes, it's okay. And on the far right, you can see the Legislative Budget Committee recommendation. So the Legislative Budget Committee did not recommend that enhancement request for those 2 additional analysts. I would note that the governor's recommendation, or the governor's proposal that did come out yesterday did include those 2 positions. And that is important to know because for this committee, if the will of the committee is to include those positions, it will take a formal recommendation to put them back in, because it is not in the current budget bill that came out with House Bill 2007. And with that, I can stand for questions.
All right, committee, any questions? Amanda? Yep, Representative Oropeza.
Thank you, Mr. Chair. With that additional work for the last 5 years for those additional children, do we know what the number would be?
I do not know that, but Carrie might be able to provide some additional insight when she comes out.
Thank you.
Committee, any other questions? Okay. Child advocate, oh. I guess we have Representative Reese has a question first.
Yes, and we may have to just wait for do we know why the other committee, I forget their new name, the acronym, is it LBC?
They had parameters and guidelines that they were working towards. I don't have the specifics of it, but they came back with their agency change approved. That was their going in point for us to begin with. I'll just leave it at that, because I think it's what Amanda had said. If this committee differs from that position, then we get into the budget recommendation piece next week. So that's where we are.
I know, I understand that. What I was trying to get to is trying to see the reason why they did not approve the new staff, the additional staff.
I don't know that I have the fidelity on that, and I don't know that Amanda does either at this point. Is that fair to say?
The only thing I can say is that through that process, all supplementals and enhancements for the majority of, if not all agencies, were cut. So there wasn't necessarily a specific reason targeted towards Office of the Child Advocate, and it was meant to leave it up to the budget committees to choose if they would like to add that back in.
Okay,
All
thank you.
agencies.
Thank you.
Another way to look at that might be it kind of forces a zero-based budget. I mean, just that's what in effect it does. So, okay, if there are no other questions, let's have our child advocate, Carrie. Is it Lawnard? Okay, Carrie Lawnard, welcome to committee.
There we go. Thank you, Chair Bueller and Ranking Minority Leader Oropeza and members of the committee. I'm Carrie Lawnard with the Office of Child Advocate, and I appreciate the opportunity to answer any questions this afternoon. I know that for the sake of time, I won't go into too much detail about our office. I think that Amanda did a really great job. It is a new office for those of you who may not necessarily sit on other committees that have heard from me over the last 3 years. I did begin in this role originally under the executive order with the Division of the Child Advocate, and then by the will of the legislature, the Senate Bill 115 was passed, and we are now an independent office, and as of July 1st. And so with that, I think some of the questions, when you were talking about the benign budget, I think, well, ours is fairly simple, except for given the fact that we are now shifted from the Department of Administration, and now we have our own independent budget. So with that, we have been operating with a staff of 5, and so primarily the enhancement request is twofold. One is that we know that over the last 3 years, our ability to provide good customer service and timely response to these very complex child welfare cases and concerns that really deserve a lot of attention, a thorough investigation, and really as responsive as we can be to help find resolution to the concerns that are brought to us. With that, we know we have identified that there's room for improvement there. Our case analysts are carrying very high caseloads with very complex issues. And so with the expansion of the Senate bill that expands that scope now to include children that are receiving services that are either in the custody of the Department of Corrections or receiving services within the last 5 years, we anticipate that those concerns and those complaints that are going to come to us are going to increase. Do we have an anticipated number? We don't know yet what that will look like. So our enhancement request does include a request for 2 additional FTEs. I think as Amanda explained, we did have some dollars that were reapportioned to us for 2025. The proposal is that we're able to essentially fund that position through 2025, but we would need then additional dollars to be able to maintain that 6th position. And with that, Chair, I can provide more detail about the agency, but what I will say is we do have a fairly extensive annual report that I would encourage everyone to take a look at that is posted on our website. I'm also more than happy to provide that to the committee, either via PDF or paper copy.
For your testimony. So I will open it up to committee. Any questions of the child advocate? This is new. I mean, it changed last year, and so an opportunity to ask questions if you so choose.
Yeah, Mr. Chairman.
Representative King.
Yeah, if you would email that to us, just a good reminder for us to see that again. Look forward to looking at that.
More than happy to do that, Representative.
And when this office was created, this 500,000-ish, was 500,000 taken out of another budget to go, or was this in addition to?
Representative, thank you for the question. So as of July 1, the Office of the Child Advocate essentially entered into a memorandum agreement with the Department of Administration transferring those dollars to our individual independent budget.
Okay, committee, any other questions? Okay, Carrie, thank you so much.
Thank you, Chair.
Let me look back at my agenda, and next one we have is the Kansas Guardianship Program. Julie, are you leading this one off? All right.
Okay, good afternoon, Mr. Chair and members of the committee. My name is Julia Kofoid, and I am with Legislative Research. And today I will be presenting the budget for the Kansas Guardianship Program. I will note that the interim director for the Guardianship Program is with us in the audience today, Nancy Mayberry, and she also has testimony to provide afterwards for us with time provided. On the first page of the budget summary, you will find the first figure, which has an overview of fiscal years 2024 through 2026. And the Kansas Guardianship Program serves adults who are without family or financial resources and who, through either physical or mental impairment or disability, are identified by the Department for Children and Families or the Department for Aging and Disability Services as in need of a court-appointed guardian or a conservator. The Kansas Guardianship Program recruits volunteers who become qualified and trained to serve in that capacity. The state then serves as the surety on the bond for the volunteer conservators serving in the program. If you'll turn to page 2, I will begin the analysis for this budget. Figure 3 will show the SGF and all other fund actuals approved and agency requests. The agency is requesting just over $1.5 million for fiscal year 2025, which will be the same as the approved amount that they got for fiscal year 2025. The agency carried over just under $100,000 of reappropriations, which have been removed by the LBC. This reappropriation was for the leadership changes of 2 senior positions, including the director, but the LBC did decide to table these funds. I will note that the governor recommendation did including these funds in the budget. There were no supplemental requests for this agency in 2025. Moving on to other changes, the agency revised estimate included salaries and wages decrease of just over $86,000. This was due to the retirement of the 2 positions I mentioned earlier, which included the executive director. They also had a revised estimate for contractual services, which was a decrease of just over $22,500 in SGF. This was due to a decrease in other fees attributable to volunteers choosing not to take their monthly stipends. The monthly stipends are $40 per month, and I'll also note that their current numbers show that they have around 717 guardians in the program. They also had a increase for capital outlay of just over $112,000. This was specifically for microcomputer equipment to be designated for replacing computer servers, updating the software, and replacing computer monitors, among other equipment. In all other adjustments, they included a decrease of just under $4,000. This was for decreases in equipment rental and postage. Are there any questions before I move on to fiscal year 2026?
Committee, any questions? Okay, let's move on.
Perfect. If you'll turn to page 4, I'll move on to fiscal year 2026. The agency is requesting just under $1.5 million, which is a decrease of just over $93,000 or 6% from the fiscal year 2025 approved amount. The agency submitted no enhancement request for fiscal year 2026. For other changes, the agency requested an increase of just under $34,000 SGF for salaries and wages. This includes a 5% pay raise for all employees except a single vacant position. The LBC did delete this due to a global recommendation. However, I'll also note that the governor did include this salaries and wages request in her budget. There is also a request for a decrease of just over $22,000 for contractual services. This was for database fees and in-state meals and lodging. Additionally, there was a decrease of just under $4,000 for all other adjustments for dues and subscriptions and other fees. And then I'll have you turn to page 6 to go over the reference tables. Figure 8, once again, shows the agency's 10-year expenditure history, including their FTE numbers. And then I'm happy to stand for questions.
Okay. Any questions at this point? Representative Orpeza.
Thank you, Mr. Chair. I know we had talked about the pay raises up to 5%. When was the last time a pay raise was given to this agency or this internship program?
I don't have that with me. That might be a question for the agency. Okay, so it would have been when the state got
everybody went to that one, so this would be an addition.
Yeah.
Okay, thank you.
Committee, any other questions? We do have Nancy here, and we have Dave Heineman here from the agency, and we also have technically Representative Ballard here from the agency since she is on the board of directors. So Nancy, would you like to come up and Dave and ask potentially any questions? Thank you, Julia.
So good afternoon, and in the interest of time, we visited with most of you already, so I'll start with, do you have any questions? Because I gave you a lot of information when I visited with you one-on-one.
Representative Ballard.
I don't have any questions, and I don't know what you told them, but I think you would just highlight why this program is one of the most unique in the entire United States.
So we live in the great state of Kansas, which has great people. Our entire program is based on volunteers. We have 10 full-time employees, but our volunteers are the ones who are appointed as guardians by the court, and this is totally a volunteer position for them. They don't do it for the money because the $40 stipend doesn't go far. we are unique in the fact that we are one of the only programs in the nation that is basically a volunteer base. Our neighbors to the east, they have paid positions and cost their state billions of dollars every year. We have saved the state of Kansas millions by having our citizens be our volunteers. So it is very awesome. I have been a volunteer for over 20 years. I can tell you that it's very rewarding. I have totally enjoyed it, although some cases were way more fun than others. And I've been a paid staff for the last 4 years, so I've got to see both sides of being a volunteer and as a staff member. I've been in this position for 8 weeks, so I am very new. I did not get to prepare this budget, so I am really new to this process. Any questions?
Representative King?
I can't remember, where are you located again, or where is the office located?
So
Is it in
our
Manhattan?
main office is in Manhattan, and we have satellite offices in the Kansas City area and Wichita, but a lot of our recruiters work from home, remote, because they travel to our volunteers.
And do you pay rent at those locations, those 3 locations?
We do, and I do not know why our home office is in Manhattan. I cannot tell you that because I wasn't here then.
All right, thank you.
May I comment on that?
Sure. Representative Ballard?
Thank you. I'll just comment on it in that Jean Fromm was the director of this program for 40 years, and she retired in June of 2024. And why it's in Manhattan, I don't know. It's been there ever since I've been here. I've been a legislature, but not that long. But when we look at the program, you must be appointed by the courts in order to do it. For $35 was the amount of stipend that they received that often they did not accept. And that was there up until like 9 years ago when we approved $5 more to 40. But I think the most unique thing about this program, if you looked in your supplement before, it talked about their volunteers have been there for 10 years or more. And part of that is because they believe in the program, but they must be appointed by the court. And part of it is you have to sign up for long-term and keep the continuity. So it's a very unique program in that they help the people to be independent, and if they can't handle their own money, if they can't do a variety of things, they do that. That's what makes this a really unique program, as you know.
Our guardians advocate for those vulnerable adults who don't have anybody else to do that for them. And as Representative Ballard said, they form a relationship with that guardian, and we have some wonderful success stories. I got asked the other day how we measured that, if there was a number, and we don't really have a number, but we have the stories. We get the stories when those guardians turn in their monthly reports, their annual reports to the court. So it's really impressive, and if you well, I don't know of anybody else besides me in this room that's a volunteer for the KGP, but probably there are several people in your community that volunteer for our program. And we currently served 1,183 as of June 30 as cases, and we had 710 active volunteers on June 30. So that means that not everybody has just one person. Some of them have more than 2. Some of them have 3. We even have some that are rock stars and have 5 or 6. So we have some very committed folks in our program, and most of them have served more than 5 years with the person that they're representing.
Okay, committee, any other questions? All right, seeing none. Nancy, thank you very much. Thank you for being here today.
Thank you for being kind.
Okay, committee. We have gone through the agenda items for today. Just a quick look ahead at, we've got the schedule for Tuesday. Tuesday's going to be a busy day. Also have the rules will be available. I got them last night, so we'll either get, Francie will be back and we'll get those on Tuesday. So with that, pending no other questions or comments, let's call it a wrap, and everybody have a safe, Amanda has an alibi. was in the Navy, we would call this an alibi. So Carrie would like to address the 7.5%. Carrie Lunner from the Office of Child Advocate. Go ahead, Carrie.
Thank you, Chair, and members of the committee, and I apologize, you thought you were getting out of here. I just didn't want to be remiss. We were moving so quickly, and I do want to honor the request that had been made by the House of Appropriations Chairman Waymaster, requesting that each agency essentially pull together a proposal of a 7.5% decrease if that were necessary. And so quickly pulled that together. I do have supplemental written testimony that I can provide to each one of you. But essentially, I think because I was the only one who was SGF to go, I went right over that. So 7.5% decrease for our agency would be very challenging, given our majority of our budget is wrapped up in salaries. And so when you look at where we could try to cut those costs, a majority of the remaining amount is in our operations, which is a very limited amount. And so more than likely, we would be having to look at cutting a position, which, as you heard from me earlier, is contrary to our request for an enhancement for 2 additional FTEs. And so, Chair, that was a very quick rundown of what our proposal would be if that were asked of us, and I'm more than happy to stand for questions.
That is a perfect opportunity. Does anybody have any questions for Carrie at this point? So, I mean, just to be clear, so it was a request for an incremental 2 FTEs, and that's the part that was removed, correct? I just want to make sure that I've got it here. I just don't want to have to dig back through it.
So, Chair, thank you for the question. Our enhancement request included an additional 2 FTEs. So we're presently staffed at 5, and we are requesting an enhancement request to approve 2 FTEs. If we were required, if that was not approved, and then we were required to decrease our budget by 7.5%, then we would most likely have to look at eliminating a position, which would move us to 4 FTEs instead of 5.
Okay, thank you.
As of today.
Thank you for the clarification.
Sure.
Appreciate it. Okay, committee, any other questions? Any other alibis?
Does
Representative Oropeza, no, you're good.
Sorry, I'm jumping in. I'm sorry, Mr. Chair, does the KGP want to talk about their 7%? Yeah. I'm just looking at the notes online. I just thought maybe you should present it to us.
All right, Nancy, would you like? Go ahead.
Okay, so the 7.5%, if we were to have to cut that from our budget, it would essentially come from the stipends. And that's where our volunteers who work for literally pennies on the dollar, if you consider it work, that's where it would come from. Does that answer your question?
Yes, I just wanted to make sure that was clear to everybody where your 7.5, if it came to that, where it would come from.
Yes, it would come out of the stipends.
Okay, thank you.
Any other questions?
Going once, going twice. All right, we'll call this meeting a wrap, and we'll see everybody back here on Tuesday. Have a safe weekend, everybody. Thank you.